Hi, in this video I'm going to be talking about trauma, the trauma response, and breast cancer and its treatment. Before I do that though, I'd love to invite you to subscribe to our channel. And as always, you can go to yerbba.com for your personalized report. What is trauma? Why might it show up around breast cancer and its treatment? And what can you do if you find you're experiencing trauma? Trauma is defined multiple different ways. The way I'm going to define it for this video and for this discussion is trauma is anything that interrupts your life story. It's something that disturbs your life story. So breast cancer and its treatment alone can be traumatic, and you may be dealing with trauma in your life before you were diagnosed with breast cancer, and breast cancer and its treatment can actually raise up the specter of trauma again. If you had medical trauma earlier in your life, you had a procedure done and you were not under anesthesia, you were still awake. If you had your dignity violated when you were in a medical setting by a medical provider, stigmatizing language was used, you were shamed. In another medical setting, now that you're seeing a lot of doctors and a lot of medical teams, that trauma can come up again. But you may have had trauma in your childhood related to your first family, or something that occurred to you between you and a random stranger. Let's talk about the trauma of breast cancer itself. Breast cancer interrupts your life story. Before breast cancer, you were pretty busy. You were not looking around for something to do. You may be a mom, you may be a wife, you may be a husband, you may be a dad. Your life is richly blessed with opportunities to learn, to grow, to contribute. And now breast cancer comes along. It's like reading a book, and something happens in the middle of the book to the character. That is breast cancer. Your life story was pretty interesting already. And now you're lifted up out of your former life, right? And expected to function. The other thing about trauma is the way different things affect people is because we each have a different response to trauma. So some scholars, some researchers in this area, and therapists in this area define trauma by how you respond to that event. So I've had patients with breast cancer who won't watch this channel because that was a small part of their story and they don't think about breast cancer. It didn't really affect how they felt about themselves or their life story. That's not you. You're watching this because breast cancer has disturbed your life story. How you respond to that disruption of your life story, the trauma response, actually can be used to define trauma. So that's how we know that different people respond differently to the same interruptions in their life. So what are examples of trauma responses? There are amazing things that count as trauma responses. I recently learned that hoarding, if you tend not to be able to get rid of things, is a trauma response. Who would have guessed? If you're a hoarder, you may know what I'm talking about. It's the way you feel safe, is to keep your belongings with you and not discard them. Trauma responses, we can feel those in our body. We can have a stimulus, something that reminds us of the trauma, and our heart rate goes up and we become sweaty or we freeze. We may become really agitated. We may shut down. There are lots of different ways we can respond, all of which are trauma responses. So think about your own experiences with stressful life events that disrupted your life story, and think about how you respond in your body, your thoughts, ways you act, things you do that maybe seem inexplicable to you. Those are probably all normal trauma responses. And that means no matter what the disruption, you had trauma. So we're defining trauma by how we respond to it. And that's probably a really helpful way for people to think about this. And again, breast cancer and its trauma are probably heaped on other things that happened earlier in your life. Very few of us will get through life without some trauma, and many of us have more than one or even more than two traumatic events, and we kind of get set up to respond to traumas in a certain way. So what can we do about it? Well, the first thing is awareness. Being aware that you might be responding as if to a trauma can be really validating for people. The other thing to do is find people with whom you feel safe. People who invalidate your experience and say things like, well, at least such and such, or, oh, that shouldn't be trauma, or why do you feel that way, are not safe people. You need people who can listen and say, wow, that does sound traumatic. You may need to coach the people in your life and tell them what you need to hear. You may need to have them watch this video. That's okay. You know, people are powerless when they see other people, especially people they love a lot, hurting, and they go into fixing mode, and it's really hard for them just to listen. A lot of us want to fix when we see somebody hurting. So finding somebody with whom you're safe. The next thing to do is reach out to an expert. I am not an expert in trauma. Even though I'm a coach and a physician, I do not diagnose trauma. I help people find people who can. So find an expert. This may be a therapist, a counselor, a psychiatrist, your primary care doctor. It may be a group on the internet. You know, you can find out and be validated and have the type of trauma that you're experiencing validated, and then set up a treatment plan. So what are some of the treatments? Well, first of all, I'd encourage you to understand what are your triggers. For many people, it's a sound, a sight, a smell, a place. Smells especially are powerful and can bring back old memories. Turns out of all the senses, our sense of smell can remember things from when we were the youngest. So smells can remind us of something from when we were 2. Whereas sounds, it's a little later in our life that sounds remind us of things. So it can be anything. It can be the way, you know, the light hits the wall on your apartment wall, in your apartment. It can be somebody you see, or somebody who looks like somebody you can see. So trying to identify your triggers can be really helpful. If you find that writing things down helps you process things, that can be really helpful as well. Although, if you are not well resourced, delving into trauma on your own can be quite, can be activating and may not be the right thing for you to do. So it depends on the level of trauma. The other thing that you can do is connect with your body through things such as yoga or acupuncture. These can be really helpful integrative therapies. You'll want to go to somebody who is trauma informed. You want to go to somebody who's done extra training in working with people who've had trauma. Not every yoga instructor has. The other thing to do is to investigate other therapies that are done with an expert, such as eye movement desensitization, or EMDR. There are other types of therapy that are done with professionals. And you can look for help in your area or on the internet. I know I've covered a lot and that this can be a really sensitive topic. I hope that you will drop comments or questions below. I hope this video was helpful. Don't forget to subscribe to our channel and to go to yerbba.com for your personalized report. Thank you for watching.